Labor and childbirth are extraordinary journeys, filled with anticipation, hard work, and, finally, the joy of meeting your baby. Today, we'll walk through the 3 stages of labor, what to expect at each step, and simple ways you can promote comfort throughout. Stage 1 is the dilation of the cervix. This is the first stage of labor, and it is the longest, and it is all about your cervix opening or dilating from 0 to 10 centimeters. This stage has 3 phases. Phase 1 is called the latent phase. The latent phase is the easiest and slowest phase, lasting anywhere from 6 hours to 3 days. Contractions are mild and irregular, maybe every 20 to 25 minutes, lasting just 30 to 45 seconds. Your cervix opens from 0 to 5 centimeters. You might notice a thick, pink vaginal discharge. This is your mucus plug, protecting your baby from bacteria. During this phase, you may need some comforts, which are trying to rest and sleep, if it's night. And if it's day, stay upright and gently active to help your baby move into position. During this phase, warm baths, massages, and light snacks can help boost comfort and energy. Regular urinating can give your uterus more room to contract effectively. Phase 2 is the phase of active labor. In this phase, contractions get stronger, every 2 to 3 minutes, lasting about 1 minute. After that, your cervix will dilate to 8 centimeters. And this is the time to head to the hospital or birthing center. Next is the phase 3, the transition phase. This is the most intense part of stage 1. In this stage, contractions can last up to 90 seconds, with almost no break in between. You may also feel shaky, nauseous, or even vomit. This is normal. Your cervix fully opens to 10 centimeters, and your baby begins descending into the birth canal. Pressure in your rectum will increase, and you may feel the urge to push. Stage 2, pushing and birth. Now it's time to help your baby into the world. This stage usually lasts about 1 hour. Your water may break if it hasn't already. Your baby's head will rotate under your pubic bone and move toward the vaginal opening. When the head becomes visible during contractions, called crowning, you might feel an intense burning sensation. But that is usually brief. And just within 1 or 2 contractions, your baby is born. After delivery, your newborn will be placed on your belly for immediate skin-to-skin contact, which supports bonding and helps initiate breastfeeding. The last stage, stage 3, is the delivery of the placenta. This final stage takes about 5 to 30 minutes. You will possibly have mild contractions again, which help the placenta detach and be delivered. Once complete, your medical team will ensure bleeding is controlled, and your recovery begins. Understanding each stage of labor, and how to stay comfortable, can help you feel more prepared and empowered. Every birth is unique, but knowing what's ahead can make all the difference. If you found this helpful, explore our other videos on breastfeeding and C-sections for more guidance. Or click on the link on this video.